Hello, everybody. It's Robin Young again. And in this video, we're going to cover the purpose and objective of a research co-op. The simple purpose of a research co-op is to improve each individual life science researcher's ability to create, test, and disseminate presumably exceptional and objective life science research. To accomplish this purpose, the research co-op will do a number of things. First, it'll create an improved system for global life science research collaboration. It's just the function of any co-op. The cooperative members are linked together. Stream. We intend to stream access to large sets of relevant, timely, and validated HIPAA compliant and cleaned data. No annual contract required for a member of academia. For a member who is co-op member, we charge a $300 co-op membership fee. It's an annual fee. And if you are working for a pharma or device company and you're in the research department there, to get access to all of this data, the pricing goes up. It's higher than $300 a year. And you are able, as a co-op member, to upload your studies, upload your data, direct where it gets shared, allow who you want to access it. And if you do that, and if others use your data, use your studies, we share a percentage of our streaming income with you. So you can get paid for your work. Again, you retain all title to everything you create. The other thing we do is we create software apps which improve the quality, accuracy, and objectivity of individual life science researchers' work product. For example, we're planning a stat check app, a virtual peer review app. So we are going to be focusing on however we can improve the way that life science researchers do their work, meet their needs, focus entirely on what they need. The other thing we do, and of course, this is one of the key aspects of a co-op like this, is we are first required by law, but we want to share the vast majority of profits back to our membership. And in effect, to create a whole new way of funding life science researcher. We want to increase that. We are partnering currently with the Orthopedic Research and Education Foundation, and we intend to partner with other foundations as well to, again, be another source of funding. And every member of the co-op obviously gets the funding. If you apply for funding, you'll get a percentage of what we have available for funding. We also want to create an infrastructure for data uploading, sharing, and funding. Again, co-op members only. There is the amount of life sciences data is exploding right now. And in fact, it's growing at about 36% a year. It is the largest single sector of data in the world, actually. And we want to put in place an infrastructure that allows for safe sharing of that data within the co-op system. And if we do all of these things, and never happens overnight, takes a long time, but should it come to pass, it would create one of the largest data oceans of both correlative and causative data anywhere. So the the other aspect of the research co-op structure is tackling the issue of creation of life science studies and data. Again, one of our core goals is to make the creation of data and studies better, more efficient, more insightful. So big data and the advent of these new powerful software algorithms, generally referred to as artificial intelligence, but which in fact represent a wide range of self-learning powerful tools, are radically changing how life science research is created and tested. The advent, for example, of CRISPR has caused an explosion of novel drug and biologic targets. The life science research community globally is entering a period of accelerating innovation and a massive life science study bottleneck, in my opinion. While, for example, promising drug and biologic targets may be doubling, tripling, or more, a 2-year study is still a 2-year study. Scalability of life science researchers, therefore, a key issue, and one that a co op, I think, is uniquely qualified to address. By improving access while simultaneously lowering the cost and barriers to large data sets, the research co op is the right development at the right moment in history to address these kind of structural challenges. The other thing we want to address is the testing of life science research. Maintaining, if not actually improving, the quality and objectivity of life science researcher testing and peer reviewing has been a difficult problem for three basic factors, I think. First, there's kind of an artisanal approach to peer reviewing, and there's an over reliance on p value. These are debatable topics for sure. However, peer reviewing as an artisanal craft based practice, well, since three shareholder owned and controlled firms dominate journal publishing, there's little economic incentive for them to find a more structured, rigorous, process based peer review system. Furthermore, approximately 60% of all submitted studies are rejected for publication, which it sets in place this pay for publishing system. That's what reinforces that. And it pressures researchers and others to game the system. An over reliance, for example, on p value as a gatekeeping measure to publish incentivizes such things as p value hacking. The other issue is inadequate funding. This is if you are a researcher, you're part of a lab, 90% of you, I'm sure, would say you're just not getting the funding that you need. That's critical, not only to reduce the dilatory effects of the current incentive structure, publish or perish, but to improve the quality, contextuality, accuracy, and objectivity of life science research. If indeed a research bottleneck is on the horizon, and I think it is, then more funding is urgently needed, and a research co op has the potential of being a very significant source of new funding. Lack of global data access. Every day, the life science research community generates more than a quintillion bytes of data. Within those unstructured, uncurated, messy data sets are insights that could transform medicine. Given the law of large numbers, the advent of powerful self-learning algorithms, and increased researcher access to this data, the average life science that can address some of those issues. The average life science uh, researcher does not have access to big data, and the research co-op can change that. Then the third and final area, part of our objectives, is to improve the dissemination of life science research. Again, in a sense, circumventing the oligopoly. Dissemination of life science research is a serious issue, and it bedevils every major life science research lab and center. The handful of shareholder-owned publishers who dominate the business of journal publishing reject 60% of all submitted papers, about 20% before peer review, 40% after. Those that are accepted, particularly for open access journals, pay to publish. The German researcher Stephanie Haustein and her team calculated the amount that researchers have paid to be published. The five largest publications, she calculated, received $1.06 billion over 6 years from the authors who submitted their work. Life science researchers are judged by the number of studies they publish. One so-called scientist found a way to game the system, and he published 176 papers in 1 year, which is one study every 2 days, even on topics unrelated to his field of expertise. How did he do it? Well, it's a pay for publish system. He paid. According to Haustein's data, Springer's Nature journal took the lion's share of researcher payments for publishing, with $590 million, followed by Elsevier, $221 million, and Wiley, $114 million. On average, authors are forced to pay more than $2,500 per study to be published. Two journals, Scientific Reports and Nature Communications, are profit-making machines. Scientific Reports publish 22,000 papers each year, the most in the world, and they charge $2,490 for each one. Do the math. Nature Communications publishes about 7,500 articles a year and charges $6,490 per article. Finally, Nature, the jewel in the crown of scientific publishing, charges $11,690 per study. According to a 2015 opinion piece in the Straits Times, no more than 10 people read the average peer-reviewed journal article in its entirety. However, a 2018 Chronicle opinion essay claims that at least one study found that the average academic article is read by about 10 people and that half of those articles are never read. A 2007 study found that up to 50% of papers are never read by anyone other than their authors, referees, and journal editors. The co-op is going to take a different approach. Individual life science researchers who upload their research will find that their work is automatically pushed out to life science researchers with the same or similar interests. We'll talk about quality later. This approach to push relevant research out to like-minded colleagues, ranked, curated, and controlled by the receiving researcher, a way that we address the issue of quality, will result in rising reader statistics, if not also impact factors for individual researchers. And let me close this one video with a quick discussion of funding life science research. The Research Co-op is a brand new way to provide funding for life science researchers in, well, two ways with a third comment. First, we pay for uploaded studies or data based on how many subscribers read or download the content. It's sort of like YouTube. Note, all content is proactively pushed out to relevant subscribers. When a member checks their Research Co-op downloads, which are personalized to each individual researcher, they'll see it's been updated with the latest research, including new research uploaded by co-op members. So you're going to have this, you have a dashboard. You will see every day what's available to you that's relevant to what you want, whether it's from, data sources that are already gathering data, or fellow co-op members who are also researching the things you're researching, who are sharing with you some of the things they're working on. It could be half-baked, it could be fully baked, it could be ready for publishing. And you are the gatekeeper. You choose what you want to see or not see. Number two, up to 75% of the profits are going to be returned to you, the co-op members, in the form of research funding. And we're partnering with foundations who are currently funding researchers to help not only improve what they do, but just put more money into the system. And it's aimed at co-op members. And the last comment I'll make is this business of providing publishing and data access for the for-profit community, it's a massively profitable business. Just on the publishing side, it's north of $13 billion. On the data side, it's north of $60 billion of revenue. A co-op coming into this market can generate significant amounts of revenue, and it's a mechanism to, again, bring power back to the individual researcher and lab and clinic, and provide all of these services in addition to funding. All right, that's all I have in this video, and there are more videos for you to look at, and I thank you, of course, for your time and attention, and hope to hear from you soon. Thank you.